Yeah, just to speak. Okay. Hi, good morning. Thank you for joining us today. There's some microphones around here. Let me make sure that I don't mess them up. 1 month ago, at an in-person pandemic task force meeting, I said we could see the end of this pandemic on the horizon if we did two things: work together to protect one another and get vaccinated. That hasn't changed. We still see the end of this crisis, but we have to rededicate ourselves to both of these principles. More and more people are making the decision to get vaccinated to protect themselves and their loved ones from COVID-19. That's great news. I did my research, got the facts, talked to my doctor, and made sure my entire family is vaccinated, including my 13-year-old son. But while more people are getting vaccinated, we are still at a dangerous point. Last week, facing case infection numbers not seen since our deadly spike in the winter, the St. Louis Pandemic Task Force urged residents to mask up and stop the spread of COVID-19. You can still spread COVID-19 even if you are vaccinated. You can still get sick. 1/2 of all COVID-19 cases in the United States are occurring in these 3 states: Texas, Florida, and right here in Missouri. The Delta variant, the most infectious and dangerous strain of COVID-19, took hold in Springfield, Missouri, before spreading like wildfire around our state and now is on our doorstep. The reality of this virus has changed from a year ago. At the urging of local health experts with the St. Louis Pandemic Task Force, County Executive Dr. Sam Page and I took action by instating a mask mandate to stop the spread of COVID-19. As of yesterday, the CDC is considering doing the same. Masking and vaccination go hand in hand. Getting vaccinated is critically important. While you can still catch COVID-19 if you're vaccinated, your risk of ending up seriously sick or in the ICU is greatly reduced. That frees up our hospitals to take care of people who need help, whether they are sick with COVID-19 or not. We don't want our grandparents, our loved ones turned away from a hospital bed if they need one. Wear a mask to protect those around you and to stop the spread. Both of these together are solutions to protect each other, to keep each other safe, and help our hospitals and medical professionals provide the care our communities need. But already, we see right-wing politicians try to tell us what's best for St. Louis, teeing off against our city to score political points. Our Attorney General, who is running for Senate and has a history of filing failed lawsuits, wants to file another frivolous lawsuit to serve his own interests and at the expense of public health. It's easy to grandstand with your biggest concern is filming your next campaign commercial and chasing clout. Dr. Page and I are taking action now so this crisis does not escalate or spiral even further. Vaccination remains a top priority for my administration. Besides holding events at pop-up clinics and community centers, our Department of Health is looking at connecting with people at the places they visit on a regular basis, like barbershops and beauty salons. We're seeing the highest uptick in vaccinations are in the black community. These same neighborhoods account for about 3/4 or 75% of all new cases. My administration is examining every possible avenue to encourage vaccination and to meet the hesitant where they are in their own communities. Since June, I have been stressing the urgency of using federal dollars to get shots in arms. And even though those funds have been tied up in political games, people can't wait. And I'll end on this note. We see the largest amount of hospitalizations in young adults between the ages of 20 to 29. Many of our youth don't recognize the risk this virus poses, not just to them, but to their families as well. I lost my only remaining uncle to COVID-19 in November. He passed away in a local nursing home. Even if you aren't concerned for yourself, think about the people in your life and in our region who need to be protected from this virus. Vaccines help keep us safe, healthy, and out of the ICU. Masks help stop the spread of disease. We came together once to protect each other, and I am confident that we can do so again. Thank you, and now I'd like to bring up Dr. Sam Page.
Good morning. These masks save lives. They prevented thousands of people from getting sick and dying. And when the mayor and I stood here in May and announced that our health departments would be relaxing some of the public health orders and protocols, including wearing masks, we did so because the case rate was headed in the right direction and vaccine access was improving. Both trends, again, in the right direction. But the Delta variant has thrown us a curveball. It's highly transmissible, and it's now jeopardizing our progress. On June 1st, the number of COVID-positive cases in St. Louis County was 40 a day. 2 months later, on Saturday, the number of cases was at 218 a day. On June 1st, the positivity rate was 2.9% in St. Louis County, and 2 months later, on Saturday, it's 9.9%. These numbers are too alarming to ignore. We, as healthcare professionals and as elected officials, can't stand idly by while this new Delta variant takes more and more victims. Masks have become a symbol of a political divide in our country. But they're not a bridge too far, as some might say. Rather, they put the virus in the slow lane and give us time to get more people vaccinated. In St. Louis County, we've launched Revive STL, an education campaign featuring people who have been vaccinated, talking about the vaccine, their experience, and urging others to get vaccinated as well. While we're diligently working to get vaccination rates higher, masks still allow us to get more and more people vaccinated and get our kids back in the classroom. Masks will allow businesses to remain open. Masks will allow our economy to continue growing and will keep people employed. Masks will allow us to keep doing what we're doing while we get more people vaccinated. And vaccination remains our focus. My priority is using all of our resources on education on and access to vaccinations. And the virus continues to disproportionately affect the African American community. Repeated opposition to medical experts who've been on the front lines of this pandemic for the past 18 months is adding oppression to the oppressed. Solutions must be for everyone, not just a select few. For real equity in our community, we have to have some inconveniences for some people. To have a safe and healthy region for everyone, it must include equity for all. Creating distractions for political gain is short-sighted at best and life-threatening at worst. As some passionate supporters of the previous president hold on tight to bombast and misinformation, we are laser-focused on protecting the health and welfare of people in our communities. Masks provide the freedom to move about in our community while vaccinations continue and our efforts continue to get as many people vaccinated as possible in our community and across the country. For those who are vaccinated, this may feel like punishment. Punishment for doing the right thing. I've heard that, and I feel that frustration. While the vaccine can protect against serious illness, it can't protect you from being infected with COVID-19 and passing it on to someone else, someone who may be more vulnerable. Until more people get vaccinated, we must continue to do what we can to protect ourselves and others. I wish we had more people vaccinated, but right now, this is where we are. Last week, the U.S. Surgeon General said that he would support those local communities like ours, initiating mask mandates, masking protocols, masking requirements in areas where COVID is surging, like Missouri. And yesterday, the American Academy of Pediatrics, only a few days ago, made a statement that they supported masking for kids over 2 in schools and teachers and staff, regardless of vaccination status. And the St. Louis Metropolitan Pandemic Task Force has recommended masking when you're in crowded public places, especially if you don't know the vaccination status of those in the room with you. As an anesthesiologist, I work an occasional shift in a hospital. I've had the chance to talk to people who've been on the front lines over the past 18 months. Those who have been sitting with patients in the ICU when they ask to be vaccinated, patients who are struggling to breathe and being placed on the ventilator, then is not the time to get a vaccine. Don't think that this won't happen to you. There are plenty of people who can tell you differently. We are among the first counties in the country to reinstate a mask mandate. So help us be one of the first counties in the country to eliminate this pandemic. If you haven't been vaccinated, please get your shot today. I'd be glad to answer any questions, and Dr. Dunnigan is here as well from the Pandemic Task Force to answer questions. Yes? Okay, so the question is about targets for lifting the mask mandate and enforcement. So I'll take the targets first, and then I'll let Mayor Jones respond. We will certainly continue to make all of our decisions regarding public health protocols based on expert advice from our public health experts in our public health department and the Pandemic Task Force and national experts. We'd like to see the case rate going in the right direction. In the past, we had targeted 100 cases a day in St. Louis County as a time when we would consider changing restrictions, and that would be a reasonable goal. We would continue to also consider, is this going in the right direction or the wrong direction, how full are our hospitals, and is there a new variant that's limiting the impact of the vaccine. But all of our decisions will be made regarding public health protocols based on expert advice from public health professionals nationally and locally here in St. Louis. As far as enforcement, we'll do this like we did before. We'll look at this on a case-by-case basis. We certainly are focusing all of our energy on getting people vaccinated, and we are fully aware of all the challenges around enforcement. What we've seen in the past in our community, when we tell folks this is the right thing to do, the vast majority of folks will do it. And the folks that don't do it are going to be outliers, and that'll certainly include folks that don't want to protect themselves or others for political gain. Would you like to add anything to that? Yeah, there are two pockets of folks. There's vaccine hesitancy, and we're working through that through education programs, peer-to-peer, a very intense effort in St. Louis County and St. Louis City, including door-to-door campaigns and communication and activity through social, print, radio, and TV ads, and we'll continue that intensity. There's another group, vaccine hostility, and we hope that we can turn that down. Unfortunately, that's fueled by the political environment, and that's just an unfortunate time in our history. Add anything?
Yeah, just adding to what Dr. Page said, we are using our every resource available to try to educate people. The best way to do that is to meet people where they are. That's why we have initiatives going in barbershops, beauty salons, churches. We're showing up at just about every community event we can. There was one just last Friday with State Representative Kimberly Ann Collins at Farragut Elementary School, and we had a vaccination truck site, and we saw people actively getting vaccinated. So we have to meet people where they are. There is an uptick, but again, just not exactly where we need to be, and especially in the African American community, only 23% of African Americans are vaccinated, and yet we're over 75% of new cases. Yes. Well, that's assuming that he's successful, and he won't be. I mean, he even sued China over the over COVID-19, and he wasn't successful in that. I wish that he would put more of his attention towards serving the people of the state of Missouri instead of and also holding our health and safety paramount instead of filing frivolous lawsuits that waste taxpayer dollars. I'm sorry, what? Well, we'll cross that bridge when we come to it. If by chance that we have to take this before the Board of Aldermen in 30 days, we're willing to do so. Aldermen yet about the mask mandate. Any update on Board Bill 2? We are continuing to reach out to President Reed to try to come to a compromise. Again, the language that he has in Board Bill 2 does not pass muster, does not follow U.S. Treasury guidelines, and we continue to reach out to find a way forward on Board Bill 2 because we want to make sure that we get shots in arms and resources to the people that need it most. I'm sorry, what? We are still evaluating that with the Comptroller's office. Yes. I'm sorry, he has. How will they affect the reopening of schools? I don't think this affects reopening of schools or any business that's currently opening or is currently open. We just are reinstituting a mask mandate in public spaces.
I think we'd probably add something to that.
Go ahead.
I think it's important to recognize that this mask mandate is what helps us get our kids back in the classroom and keeps us on a trajectory towards in-person learning, which is very important. We have a lot of pediatricians in the community that are very active in that conversation about in-person learning, that recognize that we have revised quarantine guidelines for students who are masked as a very important part of keeping kids in the room, and that's part of the reason why the American Academy of Pediatrics came out with their recommendation for masking in schools of students and staff regardless of their vaccination status. The question is clarification on the mask mandate. It applies to all indoor eating and drinking, and you can't wear a mask when you're eating and drinking. We understand that, so those guidelines will continue. Yes? Well, you know, just like everything we do, we of our public health orders. So the question is why carve out differences for eating and drinking for restaurants and bars, and restaurants and bars have done a lot to accommodate. They've been great partners with us in helping come up with these guidelines. Folks are distanced in restaurants and bars for the most part, and they're in small groups. So as long as the case rate stays where it is, we're going to work hard to avoid any other restrictions. And we believe that instituting this mask mandate keeps us on track as much as possible of avoiding any other restrictions in our community. Yeah. You know, this is the question is, how do you deal with the mask mandate and the confrontations around it? I would just recognize that this is a very difficult time in the history of our country and the history of our community, and we have to work through this together. And there will certainly be some disagreements. There will certainly be some confrontations. That's the country we live in. We have political discussions. Unfortunately, sometimes some elected officials and candidates for office will use this as an opportunity to campaign. But what we'll see in our community, I believe, is what we saw before, is most people just want to know what the right thing loved ones, and they'll do that. And I believe that the confrontations around this will be minimal, and we'll move forward as a community, people vaccinated, and to get on to the other challenges that
Well, you know, the CDC has to issue guidance for the entire country, and so often their recommendations are a general set of rules to follow. From a disease perspective, it really depends a lot on what the case rates are in your local region about what you have to do. So for St. Louis, I don't see anything that they could say that would change us from the course that we're on right now. We simply have contagion rates that are unacceptably high. And unless we do something to put a barrier between the infected and the uninfected, we're going to see that rate escalate further. No. So far, almost any mask works a lot better than no mask. There have been studies that show that some of the thin masks that are like t-shirt material, single thickness, aren't as protective. But I think the evidence is mounting that even homemade masks will suffice in the pinch. Certainly, the sort of medical grade masks have tighter characteristics than others. But really, the most important thing is wear a mask, cloth or paper or otherwise. You know, variants become dominant because they're more transmissible than the previous version. And we've seen it in 3 stair steps. The original Wuhan virus was replaced by the virus that ravaged Italy. Then we saw the UK virus, now known as the Alpha variant, and now Delta. Future variants to take hold will have to have that same characteristic. So it's likely that we will see new variants coming down that are yet again a little bit more transmissible than Delta. We don't know how far it can go down that pathway, so we'll just have to keep responding to what we see in front of us. Thankfully, what we've seen so far is that the vaccines are protective against the most serious consequences of all the variants, and with fingers crossed, that'll continue to be the case. I'm sorry, I didn't quite get that. Can somebody help me? My hearing didn't get that.
I didn't understand. Could you say that one more time?
Great. So there are a lot of questions about, you know, how many people need to get vaccinated, when will we be out of the state we're in. The truth is no one knows. These are all projections. And the way you tell is when the disease starts to contract in the community. Then you know you've gotten to a point that you're making an impact. My guess is that we're going to need to push 80% or more in terms of immunity to the disease to see it in check. That could come from vaccination or from disease. But again, the duration of that's variable. From my perspective, it doesn't change what we need to do. When we see the thing expanding, we need personal protective measures. When you see it contracting, we can back off.
Thank you all for coming out today. If you did not get a copy of the health order, I do have a couple extra. Apparently, we gotta go.
My turn, Lieutenant. Thank you. Good morning, everyone. I'm Tim Fitch with the St. Louis County Council. Thank you for staying. I do not have a canned speech like you heard from the mayor and from the county executive, so I'm going to just talk with you and hear your questions. I had 30 years of sirens and gunshots, so if you pull your mask down when you have a question, I'd be happy to answer it for you. So the conversation that we're having on the county council is not about whether you should wear this or not. The conversation we're having on the county council and we'll have tomorrow night is, does the county executive have the authority or his public health director to issue these mandates? And the answer legally, clearly, is he does not. He does not, okay? That law that he's relying on in the past changed on June the 15th when the governor and the General Assembly signed and passed into law the ability of the local governing body to approve recommendations from the public health director. That's what the law says. He has not come to us, the council, and asked us for any input whatsoever. You heard him say, and the mayor say, this is about politics. It's about right-wing politics. I'm not going to inject politics into this conversation. They did, even though they will say that people are doing these things for political reasons. So that's not what it's about with us. It's about, come to us, Mr. Page, come to us and say, let's have a conversation about this. Ask for our support. And then let us decide on behalf of the 1 million people that we represent in St. Louis County whether or not we think masks are appropriate to require. So that is not our conversation. By the way, get vaccinated. I can't say it any clearer than that. That is our way out of this. Get vaccinated. So there's no political piece. I'm telling you, from my perspective, get vaccinated. By the way, I'm not running for anything. The county executive, of course, is running for county executive again in a year from now. He has a primary. So keep that in mind. He wants to keep politics in it. He wants you in front of him so he could talk to you, get free press time. I get it. I understand the politics of it. But that's not our discussion on the county council. It's about the law. Okay? So what questions do you have for me? Yes, Kim. That's a great question, Kim. I'm glad you brought that up. So she was talking about a 30 days. So the way it works is if a legal public health mandate is put into effect by the council, the clock starts ticking for 30 days. And then it automatically expires at the end of the 30 days unless the council extends it. And the council can extend it for an unlimited number of times. Or the law also says the council can terminate it at any point. So as you know, you all just were handed the order, right? Just like I was. I haven't even had a chance to see it yet. Do you know it's already in effect as of 8 a.m.? How are people supposed to know what they're required to do when you don't issue anything until after it's already in effect? There's no reason this should not have been posted on the STL Corona website way before this press conference today. That's how the county executive continues to work, is behind the scenes with the city. They've called the Cardinals, they've called grocery stores, they've done all that and not included the council in any conversation. So does that answer your question, Kim? Absolutely. The council can terminate a health order at any point. So that means if this is in effect legally right now, which I don't believe it is, but let's say it was, hypothetically, the council could vote as soon as tomorrow night to terminate that. It doesn't have to last for 30 days. It doesn't have to last for 2 hours. The council can vote at any point to terminate that. I don't know how the council would vote to say, let's not do a mask mandate, but we haven't had a chance to ask any questions about it. I asked Dr. Khan, I see he left, if he was going to be at the council meeting tomorrow night, like we requested that he be there to answer questions. And what he said is, I plan to be unless the county executive tells me I can't be. So let's see what happens. Let's see if the county executive allows him to be front and center with the 7 council members to ask our questions. And then we will decide how to vote. Does that answer your question? Thank you. Kim, could you pull down a little bit? I'm not saying that anybody's lying about it. What I'm saying is follow the law. No, I'm just saying follow the law. That's all I'm saying is follow the law. Then what the county executive should have done is on Friday when he decided to do this, ask the county council for a special meeting to have this discussion. He could have done it as soon as Monday, today. We could have had a special meeting today and said, let us hear what you have to say. Let us ask our questions. Let us hear your answers. And then we could have voted to put the mandate in place. We were never given that opportunity. Oh, sure. Right. Actually, that's not accurate. The council passed the very first legal mask mandate in the county, and I was the sponsor of that. The council voted in, and you know what the county executive said? It's not legal. They can't do that. They're not allowed to do it. Only I'm allowed to do it. So it's to say that we've bucked it is absolutely not accurate. We actually sponsored the only legally binding mandate for masks in the county. It's out there. It was voted on and passed. And he said ignore it. Yep. What we have bucked. Oh yeah, absolutely. But that, yeah. Okay, and like I said, we didn't get a chance to have the conversation. Most of our opposition was, we want to be brought into the conversation. Give us a chance. Give the 7 members that represent 1 million people in the county an opportunity to ask questions publicly and hear responses and then make our decision. That's all we've ever asked for. And then when he says, no, I'm doing it on my own, that's where the issue comes in. Yes, ma'am. Well, let's assume for some reason it's legal what he just announced. And we vote to terminate it, that means it's terminated. Simple as that. Yes, sir. Would you pull down? Well, we know what the law is. You could read the law. I'll give you all the statute numbers. But you don't have to be a lawyer to understand what's legal and isn't legal. Well, I think if someone's violating the law, for us to take affirmative action to say you can't do this, to vote on it, I think is perfectly the right thing to do. Well, let us have the conversation. Let him call a special meeting. By the way, this was announced Friday for Monday. Was it an emergency on Friday? Okay, any other questions? All right, yes, sir. Could you pull down? How is it different? It's a great question. The state law changed in June that basically said the county executive nor the public health director have sole authority to issue public health orders. Only the governing body can do that. We can hear the recommendations, but we're the ones that have to approve it. Anything else? He will order it. His signature is going to be on it. But we... Let us have the conversation, be able to ask him questions. We've never been given that opportunity. And remember, the public health director who you saw standing here could be fired tomorrow by Sam Page if he doesn't do what he wants him to do. We saw that with Hazel Irby, right? He could do the same thing to Faisal Khan. So we have to keep all that into consideration. Okay? Thank you all very much. Appreciate it. Get vaccinated. Good question.